This is Breck, and I'll be doing scenario 4. Hi, Mrs. Olson. My name is Breck, and I'm going to be your nurse practitioner today. I just wanted to go over a few things before we got started, if that was all right.
Okay.
Everything that you say in here will remain confidential unless you express a desire to hurt yourself or anyone else, and then I would have to report that to the authorities. Okay?
Okay.
We're going to go through quite a few different assessments. You had filled out a few forms for me before you came in, and I will briefly discuss that with you. I will talk about your past medical history, any past psychiatric history, and do a mini mental status exam, which just checks your cognition. Just a really full, complete evaluation. And if you have any questions at any time, please feel free to stop me and ask me why I'm doing any particular thing. And we can get started if that's all right. Do you have any questions before we get started?
No.
Okay. How would you like to be addressed?
You can call me by my first name.
And that is?
Valerie.
Okay. All right, Valerie. So tell me what got you here today.
Well, I was referred to come see somebody after my hospital visit.
Okay. What did you go to the hospital for?
My neighbor took me to the hospital. Things haven't been really going so well lately, and I had gotten really frustrated and cut myself a little bit, and she came over and I was kind of bleeding, and she made me rush to the hospital and get seen.
Okay. And then the ER fixed you up and...
Yeah, they took care of it. I mean, it really wasn't that bad, and then,
Okay.
she talked to them a lot about what was going on, and they thought it was a good idea for me to follow up.
Okay. I'm just going to let you know that because we're doing so many assessments that I'm going to have to write some things down, so I'm just going to divert my attention to this paper here for a minute just to write some things down, and we'll keep going. So just to recap on that, so your neighbor brought you to the ER because you've been having a hard time and you made some cuts on your wrist.
Yeah.
Okay.
They weren't that bad, like no stitches or anything.
Okay. Well, what got you to the point of feeling that you needed to cut your wrist? What's been happening with you?
Well, I've been kind of dating this guy for a couple of years, and it wasn't the greatest relationship. He was married, and
Okay.
I had already don't necessarily feel so great about myself, and then we broke up about a month ago, and it wasn't really a good breakup. It was really nasty, and he said some really mean things, and my kids are away for the summer with their dad, my ex-husband, and I really just have been spending a lot of time by myself and just kind of thinking about how, horrible my life is and why I can't keep anybody around, and that, nobody really cares about me enough, and I just guess I was just in a moment. I've never really done anything like that before.
Okay. All right. So let me just try to break that up a little bit. So you said you have children. How many children do you have?
I have 2.
Okay. And boys, girls?
2 boys.
And how old are they?
11 and 13.
Okay. And you said they're with your ex-husband?
They're with their father,
Their
yes.
father, okay. And you say that the relationship that you had he was a married man, and that was for about 2 years?
Yeah.
Okay. Was he ever abusive towards you physically?
No.
Okay. But you feel maybe a little bit of emotional abuse from him?
Well, I don't know if I would call it that. I mean, it's, I feel kind of a little like betrayed and maybe lied to. He always told me that their relationship was not the best, and that it was coming to an end, and that there would be, that, and that just never seemed to happen.
Okay. So when did that breakup happen again?
About a month ago.
Okay. And during, you said that you spending a lot of time alone. Did you do that while you were in the relationship, or did that really start to happen more so since the breakup?
Well, probably a little of both. I guess when we were together, if he was, with his family and with his wife,
Right.
I would be by myself,
Okay.
at home. When my kids are here, it's a little different. I have them, and their stuff to take care of, but they're gone for the whole summer.
Okay. Yeah. Okay. And you also mentioned something about not really feeling great about yourself. Can you expand on that a little bit?
I think that goes back to my marriage with my first husband, and he was, I don't know, it's just kind of a jerk, and our breakup wasn't real great, and there was a lot of trust issues and just, general, I guess he never really made me feel really secure and, really appreciated and, like, cared for. And when we split up, it was kind of nasty, and that process was really not great. And, we have kids, and it's tough on them. And then he lives in another state, so there's not even, they don't, this is why they're gone for the whole summer. And that's hard, to be away from them for that time too. And then the next relationship I get into is this guy that is not really available, and just when you just question yourself, are you good enough? Are you ever, is somebody ever really going to love you? Or you, what's wrong with you?
Right.
That these things keep not working out.
Okay. Okay. Now, do you, when you are home alone, or sitting alone, or do you cry often, or?
Sometimes. I guess it just kind of depends on the day.
Okay. How would you describe your general mood?
I don't know. I feel like I guess I'm in kind of like a funk most of the time.
Okay. Do you feel on edge ever, or irritable?
Sometimes. I think mostly when I'm at work, I feel like that. I don't really like to be around a lot of people, and I just kind of want to just stay home as much as possible. I don't really want to go out and do stuff, and I just don't see the point.
Do you find pleasure in anything? Have you lost pleasure in things that you used to find pleasure in?
Well, I guess it's probably. I mean, I don't think I've really been involved in anything that, for me, in years. Everything's since the divorce. It's just me and the kids. So, they're young and active, and it's all about them. So
You kind of put yourself aside.
Yeah, I don't really have time.
And do they stay with you year round, or do they go to their dad's like on weekends or holidays? Or
they're with me for the school year, and then we alternate like the major holidays, but then they go to see him for the summer most of the time.
Okay. And how about do you ever feel any excessive worry or anxiety about things? You feel like you said that you don't really want to be around people and kind of want to stay home. Is that because you feel that anxious about being around people, or is it more
I
your
just
mood?
really just don't want to interact with anybody.
Okay. Do you feel like you have any anxiety at all about?
No, I don't think so.
And how about, have you ever experienced any moments of possible, like, hearing stuff that may not be there? Like if you were watching TV and sort of maybe somebody was talking, like it was right towards you?
No.
Okay. And how about substances? Do you drink alcohol?
I do.
Okay. How much do you drink?
I don't know, a little here and there.
Okay. What's a little here and there?
A glass of wine or two on the weekends, maybe.
Okay. So just a couple glasses of wine on the weekends, nothing during the week?
Not usually.
Okay. Now, I understand that when your neighbor brought you in, I have the ER records here, that she mentioned that you were drinking, well, I wouldn't say quite a bit, but drinking more than you may be saying you drink now. That you drink more when you're watching TV late into the night and then sleeping most of the day. Is that an accurate statement?
I don't think it's super accurate. I mean, maybe I have more on, when I know that don't have any plans and I'm just gonna stay home, but I wouldn't say that I'm drinking as much as she thinks I am all the time.
Does that annoy you that she is
Well,
saying
a
that?
little bit. I mean, she's kind of the only person that I talk to on a regular basis, and so I kind of feel like she's making assumptions about things when that may not really be what's happening.
Okay. Have there ever been any times when you've been drinking and you felt guilty about your drinking?
No.
Okay. And how about, do you ever wake up in the morning and feel like you have to have a drink to calm your nerves or get your day going, or I'm just going to have this glass of wine because today I feel like I need to do it because I don't feel great?
I don't think that I would do that.
Okay. And the night that you got into the ER and cut your wrists there, were you drinking that night?
I'd had like a glass of wine with dinner.
Okay. All right. So do you feel that your drinking that one glass of wine lowered your inhibitions and allowed you to cut your wrists, or do you think that was just a total impulse that...
I may have been a little of both, but I just kind of really think it was more just something that I just kind of did.
Okay. Did you feel better after you did it?
Not really.
And you've never engaged in any other self-harming?
No.
That was the first time you've ever...
Yeah.
Okay. Okay. So, have you ever attempted suicide?
No.
Okay. Has anybody in your family ever attempted suicide?
No.
Nobody? So nobody's committed suicide?
No.
Okay. And, have you ever been to see a therapist or had any other psychiatric history diagnosed, like a past history of depression, or PTSD?
No. My ex-husband and I tried to see like a marriage counselor, but that was only a couple of visits. But nothing really since then.
Okay, and you didn't start on any meds or anything with that? Okay.
No, I don't like to really take a lot of medications.
Okay.
I don't usually like to take aspirin on a regular basis.
Okay. So you're not taking any meds at all?
No.
Okay. Do you have any allergies to any medications?
Not that I know of.
Okay. Well, I'm just going to assume that you haven't had any past psychiatric hospitalizations.
Mm-mm.
Okay. And past medical history, do you have any, we're going to go through a little later a review of systems, which will be a little bit more in depth, but do you have any of the, chronic illnesses such as diabetes or, or asthma or anything of that sort?
No.
Okay. And like I said, we will go through a full review the systems there. And anybody in your family ever have any psychiatric illnesses of like depression or anxiety that you're aware of?
No.
Okay.
Mm-mm.
Okay. Where were you born?
I was born in Florida.
Okay. Where?
In South Florida.
Okay. And were you raised in South Florida?
Uh-huh.
Who were you raised by?
My parents.
Both parents?
Uh-huh.
Did you have any abuse growing up?
No.
No? Okay. And what's the highest level of school you've completed?
I have a associate's degree.
And you said you have the 2 children.
Mm-hmm.
And you're currently gainfully employed?
Yes.
Okay. Is it a Monday through Friday job?
It is.
Okay. And you feel like your bills are being paid and okay? You feel
Mm-hmm.
like, okay,
Yeah.
finances are all right?
Yeah, I mean, with 2 kids, it's always a little struggle, but
Right.
everything's okay. We're not in any serious debt or anything.
Okay. So you were married just the one time?
Mm-hmm.
All right. And then then you came out of that marriage, and a little bit later you got involved with the married man.
Yes.
Okay. Any other relationships? Any high school sweethearts or anything of that
No,
sort?
I mean, my husband and I my ex-husband and I had been together for, like 18 years
Mhm.
total,
Okay.
so.
All right. And other than the drinking of the wine, have you ever taken any drugs of abuse such as heroin, cocaine, marijuana,
Mm-mm.
prescription pills,
No.
something like that? Okay. Have you ever been arrested?
No.
All right. So now I'm going to go through a review of systems. Do you have any questions up at this point?
No.
Nothing? Okay.
Mm-mm.
Okay. So review systems is basically a head-to-toe assessment, just to make sure that I didn't miss anything when we were just speaking briefly about your past medical history. So do you wear contacts or glasses?
I do wear contacts.
And you feel like you can see okay with them?
Uh-huh.
Okay. Any problems with your hearing?
No.
Any problems with chewing, swallowing, or any mouth problems?
No.
Okay. Any history of thyroid disease?
Mm-mm. Not that I know of.
Okay. When's the last time you saw your primary care?
I don't know, maybe 6 months ago. I just go usually once a year for the annual checkup, and nothing's ever been alerted to me.
Okay. And do you get yearly blood work and stuff?
Mhm.
Okay. And that was all within normal limits that you're
They
aware
didn't
of?
call me to tell me otherwise.
Okay. All right. And I know you said you didn't have any asthma, but any history of bronchitis or pneumonia of any of that
No.
sort? Any cardiac history?
Mm-mm.
Okay. GI stuff, okay? You're peeing and pooping all right?
Yeah.
Okay. Any muscle stuff?
No.
You had mentioned on one of your assessments here that you just felt a little bit of, hold on, I will find it. A little bit of unexplained aches and pains. Do you think that's related to your mood?
Maybe. I mean, I just kind of figured it was just, getting older and having kids and just the normal stuff, wear and tear.
Okay. All right. And any history of broken bones or anything of that sort?
I broke my wrist when I was, 7.
Okay. And that's healed all right. No issues with that. And no major accidents or brain injuries or anything of that
No.
sort? Okay. So you sound like you're in pretty good health. The next thing I'm going to move on to is a mini mental status exam, and that's just like I said in the beginning, it's to check your cognition, just to see how everything's working. Sometimes when you start getting depressed or other different things start happening, sometimes you just don't think as efficiently as you may think you are. So this is a good way for me to assess to see how your cognitive ability is working, okay?
Mm-hmm.
So I'm going to say 3 words. I'm going to have you repeat back to me, and then I will talk about some other stuff and then see if you can remember them.
Okay.
So the 3 words are green apple horse.
Okay.
Can you repeat them back to me?
Green apple horse.
Okay. All right. And can you tell me what this is right here?
It's like a chopstick.
Yep. And how about this?
It's a golf ball.
Right. And this.
A pen.
Okay. And how about those 3 words?
Green apple horse.
Good. Okay. And who's the current president?
Obama.
Who was the president before him?
Bush.
Okay. And I'm going to have you, just so I can show this, read this.
Close your eyes.
And can you perform it? Okay, you can open your eyes. And the other thing is, could you fold this piece of paper in half?
Does it matter which way?
Nope. And just lay it on the table.
Okay.
Okay, great. And just have you write a sentence for me.
Anything?
Yeah, just a complete sentence. Okay. All right, thank you. All right, so the next thing I want to, do you have any questions on that?
Mm-mm.
Talk to you about here, and sorry for shuffling some papers around here, is you did 3, you filled out 3 assessments for me
Right.
when you came in. So the first one was a level 1 cross-cutting symptom measure, and you scored moderate in the depression domain.
Okay.
So once I had realized that, then I had you go ahead and fill out the level 2 depression, which you are scoring for this particular assessment, moderate depression.
Okay. What does that mean exactly?
Well, we will continue to meet, hopefully, to sort of work through this. Anybody with a moderate depression, there's certain symptoms that happen when you become depressed. This sounds like to me this has been something that's been kind of building for quite some time, meaning that you just don't feel great about yourself. You don't have a lot of pleasure in life, and you have an irritable mood at work. And I didn't ask you about, which now it just reminded me about your sleep. If your sleep has been interrupted, according to your neighbor, it sounds like she says that you stay up, your sleep schedule is a little wacky.
Well, on the weekends and then.
Yeah. How do you sleep during the week?
I think during the week it's just okay. I mean, but I don't think I've slept really well since I've had kids.
Mm-hmm. Do you feel rested when you wake up?
No, not usually.
Okay. And that's another thing that contributes to some of your depression, and the fact that you had mentioned some of the unexplained aches and pains that can sometimes go along with a diagnosis of depression. It just sort of, it manifests itself physically and emotionally. But like I said, if we continue to meet and sort of go over what our treatment plan is a little bit later in this assessment, we could hopefully get something going for you to get you feeling a little better.
Okay.
Does that answer your question?
Yeah, a little.
Okay, what?
Well, I mean, I don't understand. Am I gonna now be like labeled with this, and I'm gonna, have to see doctors forever and?
No, not necessarily. Not necessarily. I do feel that, like I said, it has been building a little bit, and maybe we can, it may be a temporary thing to get you back on your feet. Maybe have to take some medications. I know you aren't really into that, but that's something we can discuss to get you back on your feet. Have a little crutch, get you walking, and then get you back going to previous happy Valerie.
Okay.
But nothing is set in stone. But as far as the label goes, I mean, that is going to be a diagnosis, just like if you had asthma, you would carry that with you. I know there can be a big stigma that sometimes people feel when they have a mental or a psychiatric disorder, but that's really your own personal information that nobody else needs to know about.
So it won't like go to my boss or
No,
my
absolutely.
insurance. What about my insurance company?
Well, for insurance companies, whatever we need to submit to get payment for and to carry, whatever they need to know. Let me. It will go to your insurance company, is I guess the long and short of it. Yes.
Okay.
But that's not going to, should not affect it. I don't think.
Okay.
Okay.
Mm-hmm.
But I can certainly look into that for you if you have any questions about that and how we can proceed if there is any. But again, it's just like any other disorder or illness that you're going to have that diagnosis and it needs to be treated.
Okay.
Okay. The other assessment that we did here was called the HUDAs, and it's based out of 100 points here. The raw score, and you scored a 59, which is showing, a moderate disability in different aspects of your life here. Obviously, you're able to get up and go to work every day, but there's things that are not working well for you. You feel not great about yourself. You've injured yourself. Your sleeping isn't great. There's things happening here, so that it makes sense that you would have a little bit of a higher score.
Mm-hmm.
And again, we're going to try to work on that to get you back to a good level and functioning good.
Okay.
Does that sound all right?
Yeah.
Okay. All right. So you said that you spoke with your neighbor. She was really the only one that you speak to. Do you have any other family or people that you feel that you could?
I don't like to burden my family with this kind of stuff. I mean, they probably wouldn't be happy to know that I was seeing somebody that wasn't married, and
Mm-hmm.
that was not the best thing. I mean, they're pretty conservative, and they don't. I don't know. I've never really felt super close to any of them, and when I got divorced, I think they just all got really disappointed that the marriage didn't work out, and that made me feel worse. And
Mm-hmm.
so I don't really talk to them about like the personal stuff. I mean, we get along fine, and I talk to them about the kids and all that, and
Mm-hmm.
but I don't really talk to them about anything that's going on with me.
Okay. All right. And so I'm gonna switch back to your neighbor again now. I'm sorry, with your family, how do you think they would? Have you ever tried to talk to them about maybe not the relationship with the married man, but just how you sort of have been feeling about your divorce and how you feel about yourself and.
Not really. I kind of get the feeling from them just from the way things were when we were going through the divorce that I guess they kind of maybe felt like I didn't do enough or I didn't try enough, and they just didn't really ever make it seem like, they were really supportive of me, and that, maybe it just really wasn't right for us, and
Mm-hmm.
that it wasn't anything that I did or didn't do, and I was already just with the way things broke up, and some of the things that he said to me at the end, and just made me really feel like the whole thing was my fault.
Mm-hmm.
And that I was never going to be good enough for him or for anybody else, and they just seemed to kind of side with him more, so I just didn't really feel like it was worth trying to fight that. I mean, they're my family. I shouldn't have to justify to them.
Right. Okay. And do you feel like the divorce is your fault?
I just don't, I just generally don't feel like I'm really good enough at this point. I guess when, you're hit with that, and things don't work out, and somebody's kind of basically telling you that
Mm-hmm.
it's not, far-fetched to think that it is.
Right.
And then this didn't work out, and I just seem to keep getting myself in these situations, and I just feel like maybe I really am not. Maybe I am the problem.
Okay. And how long have you been friends with your neighbor?
I guess we moved here, I don't know, right after the divorce. So I guess 3, 4 years.
Okay, so did she know your ex-husband or
No.
no? Okay,
No.
so she knows you post divorce. Okay,
Yes.
okay. And has she ever gave you any indication of what she thinks is the matter with you?
No, she just kind of says that I'm negative all the time and that, I'm kind of down and I need to get out more and, I need to meet new people and do stuff. But, it's more kind of like, almost like she's lecturing me a lot about what I shouldn't do and, how she thinks I should be living, and I just,
Okay.
Sometimes it's a little much.
Okay. Do you have any other friends that you confide in other than your neighbor?
Not really.
Okay. And did you have friends when you were married?
I thought I did.
Okay, so you may have lost some of your friends.
Yeah, I think I think a lot of what happened, and a lot of people just kind of sided with him, and that just made me feel even more like it was my fault, and so I lost touch with a lot of people and people that I thought were there for me and that I thought were going to be, still in my life, and they're just not.
Okay. So all this stuff has been building up for you, and when you cut your wrist, was that an attempt to end your life, or was it just? Do you have any thoughts on it?
I don't really know what that was. I mean, I don't think that I was really trying to kill myself. I mean, I don't really think about that in those kind of like terms, I guess. I don't I don't think I was trying to end it all or anything like that. I mean, I have kids. They're young. They need
Right.
parents to be around, and I love them and I don't want them to suffer, but I just thought I needed just something. I needed to just have something.
Right. Okay. And how do you feel like you, other than what you did that was not a good coping skill? How do you feel that you've been? What have you been using for coping skills? Anything that you can think of?
I think I've just been trying to go day by day and get through things. I mean, like some of my kids are here, there's all the stuff with them in school and, practices and activities and their friends stuff and running all over the place that I just kind of do.
So summers must be very difficult for you when your kids aren't around.
I think this summer is worse just because, of the relationship ending, and then just I don't have them here to distract me and to, kind of focus on them, I guess.
And does the person you ended the relationship with, does he know that you had a visit to the ER?
I don't think so.
Okay. All right. Do you utilize church or anything spiritually or religiously? Okay.
No.
All right. And how about exercise?
No, since we broke up and maybe a little before that, I've kind of gained a little bit of weight.
Okay.
And so that's not helping anything either. I've always kind of struggled with that. And then, just to gain weight and then feel even more, unworthy and just unattractive. And
Do you feel like you don't have the energy to go work out, or do you feel embarrassed of your self-image to work out? Or?
I think I'm embarrassed all the way around.
Okay.
You know, I'm embarrassed that I had to go to the hospital. I'm embarrassed that my neighbor's telling everybody I'm drunk.
Mm-hmm.
Basically, I am, I don't, I'm embarrassed that I'm, 35 and I have two kids and I have had, failed relationship after failed relationship. And
Mm-hmm.
I just don't have the motivation.
Okay. Okay. All right. So what do you envision for us to work on together?
I don't know. I didn't really have any idea coming into this. I just thought that I didn't, I got out of the hospital. They told me I needed to see somebody. I didn't really think I had a choice.
Okay. Well, I'm glad that you came. I'm very glad that you did make the decision to come here, because you do have a choice in everything that you do. And like I said, I am glad that you did make the choice here to come here. So given everything that we've sort of discussed and went through here, like I said, after some of your assessments, it does sound like you do have some depression going. And if it would be agreeable with you, I'd like to continue to meet with you to try to work on getting your self-image, your self-worth back to a manageable state for you. And possibly discussing some medications that could help you get there. I don't know. What do you think about that?
Well, I guess it's worth a shot. I mean, I don't want to end up in the hospital again, and I don't want to necessarily have my kids know that this happened, and think that they have to be worried about if I'm going to do anything like this again.
Okay. Yep. And I will state that I have a little bit of a concern, but I want to work with you on it and get a nice, good rapport and therapeutic relationship. Excuse me. That that your neighbor is very concerned about some of the drinking, and you're saying you drink 1 to 2 glasses on the weekend. So I would like to discuss that further as we move forward, if you're agreeable to that as well.
Okay.
Okay.
I mean, I don't really think that that's
Okay.
what's going on, but I mean, I guess if it's gonna just keep coming up, we might as well.
Yeah, I think it would be something good to discuss because there's many things that can contribute to diagnosis, and many things that can make it better, and many things that can make it worse. So if you are agreeable to meeting with me again, and we can move from there. Does next week at this time sound?
It should be. I mean, unless I have something with work, I'd have to check that calendar when I get back. But
Okay. And I will give you a card before you go, so that you can contact me if there is any issues from now until that time, and we can go from there.
okay.
Does that sound okay?
Yeah.
Any questions at all?
No, is it just you that I'm going to be meeting with?
Mm-hmm.
Okay.
Yep. It will just be me, and after each appointment, or coming to the end of each appointment, we can kind of decide what we want to do for the next time that we meet. Whether it needs to be, if you feel that it needs to be once a week for a little while, or once every 2 weeks. I tend to try to front load some of the visits a little bit to sort of get things going, and get a good relationship established.
Okay.
But again, it's you do have a choice, and I am glad that you came here today, and you're safe to go on home, and you don't feel any thoughts of harming yourself.
No.
Okay. Well, Valerie, again, I thank you for coming in, and I will give you my card before you go, and if you have any concerns at all before next week, then please feel free to call me.
Okay.
Okay?
Yeah.
Thank you.
Thanks.